All right, today we're going to do a demonstration on how to do Schroth Scoliosis Rehab using the stall bars. And this is really good potentially for someone that's an adolescent with scoliosis or a young adult with scoliosis. That's who we use this for the most. We can also do specific things for someone that's hyperkyphosis. We're going to show that later on in the videos. Some people this may be contradictory for or not great for. It could be someone that's post-surgical or someone that has a degenerative scoliosis, specifically someone that has a degenerative scoliosis with some instability or a large lateral aesthesis. Anyone like that really should be under the direct supervision of a skilled scoliosis provider to do these. So there's a few different ways we can do this, and we're just going to walk off and we're going to demonstrate a few different ones. So I have one of our scoliosis rehab therapists today, Emma, and Emma's going to be actually demonstrating the exercise as we walk through those. So the first one we're going to go over is called the semi-hang exercise. So as we're doing that, Emma's going to go ahead and face the wall bar, and she's going to first figure out where she's going to place her hands. She wants to put her hands at about eye level, and then she's going to make sure she gets her feet in the right spot. So she's going to put her feet right up against the stall bar right there by the bars, and she's going to start to lower herself, and she's going to lower her hips and pelvis down and back just like that. And she wants to get where her legs are about parallel to the floor, basically forming about 90-degree angles. And then she's going to make sure she has her pelvis in the right position. So Emma, just demonstrate like your pelvis in the correct versus incorrect position and kind of show what you're doing. So there you can see now she has her pelvis in a nice correct position. She has the nice curve in her lumbar spine, and then go in an incorrect position. And there she's kind of rounding her back. Now, one thing we need to be careful about is the angle of her arm in line with her torso. We want this in a nice straight line. Someone that has a thoracic scoliosis will likely have a reduced normal kyphosis or the normal curve in the mid-back. This could also be contradictory to someone that has a kyphotic or a reversal of the curve of the thoracic spine. So we got to be careful because we don't want to flatten this too much, especially in someone that has a thoracic scoliosis where they already have a reduced normal curve in the thoracic spine. So she's gonna be right there. She's gonna hang. She's gonna get a nice stretch. And then you have to really understand your spine and your scoliosis because she's trying to create some elongation in her spine, but she's also gonna do some expansion. It's something that's really popular, what we do in ScoliBalance, especially when we incorporate that from the Schroth rehabilitation exercises. So while she's hanging, if she has a collapsed area of her spine, she would actually work on expanding that collapsed area while she has her body in a nice elongated position. Now, when she's done, you can go ahead and come on up just like that. Now, that was what we would call the semi-hang exercise. And while we're doing that, we're going to incorporate some expansion exercise while we're elongating the spine. Now, another variation of that could be what's called the supported hang. And the supported hang may be more appropriate for someone that's older and is possibly someone that has a degenerative scoliosis. You might use this on. You also might use this in someone that has a weaker grip strength and they have a hard time holding onto their hands. And it could also be a progression. You may actually start off with a supported hang and eventually move into like the semi-hang. So one of the things we can do for the supported hang is we can actually have a ball that the patient could sit on. And she's gonna have her legs up against the stall bar. And this is ideal. You wanna make sure you have a ball that's the nice height, and sometimes we have to make sure these are inflated properly. But she's gonna have her arms at that same 90-degree angle with her legs about parallel. You want to avoid having a ball that's too low. Let me show you what it looks like when a ball is too low. If the ball is too low, you can see how now her hips are below her knees. That's not the right angle. It's not really going to be ideal for the situation. So you want to make sure you have the proper ball. So when you sit on it, your legs form about a nice 90-degree angle. Now, one of the things we can do with this is we can actually start off seated just like that, and we can actually start to walk our hands up the bar, just one by one, slowly walking up. And this is a way to gradually progress into some elongation. So just keep on walking up. Let's go a little bit more. And if you're an elderly patient or you have weak arms, this is great because you can make sure you don't do something that's too challenging. Let's go one more. Then eventually you can do that. And now she has most of her weight actually in her arms, a little bit here on the ball. And then we can also start to walk down if that's too much. And then go ahead and go all the way down. Now, something else we can do while we're doing that, while you're elongated, that's a great time to go in and do some of those expansion exercises that we were showing in the previous demonstration. Now, another thing we can do is while we're in here, we can actually put our spine in a correct position, which you need to be instructed by someone that's trained in ScoliBalance to do that. But we can also do some stabilizing exercises by just holding ourselves in correction and then just pressing down on the stall bars. And this is a great variation if anyone has done Schroth exercises and they're used to using sticks or poles. But if that's hard to do or you have shoulder problems, a nice variation you can do is to put yourself in correction and then to press down and then just hold that, because that'll help you contract all your stabilizing muscles. Now we're going to show one more variation of doing the Schroth exercises on the stall bar, and this is going to be using a band to help support our weight. So this would actually be a variation of the semi-hang. So let's go ahead and stand up. Let's go ahead and get a band. So there's different sizes of these bands. You want to get one that's going to be nice and thick enough. Obviously, the bigger band you get, the more support. So initially you may have a thicker, more supportive band, and you can slowly decrease the size of the band as you're able to hold yourself on your own. Now, the reason we may use a band is someone could have difficulty supporting their body weight with their hands on their own. They may have some grip or strength problems, and it's also could be a way to nicely to gradually build up to where you can do a complete semi-hang. What she's gonna do, she's gonna put that right under her, kind of her buttocks area, between her butt and her thigh, and she's gonna slowly walk down. She's gonna drop her hips back, just like before. Her feet are against the wall bar, and she's gonna hang right there. Again, making sure she doesn't extend too much to flatten the thoracic curve too much. Also, making sure her legs are about 90 degrees or 90-degree angles or parallel to the ground. She's gonna make sure she has a nice angle between her torso and her arms. And she's just gonna elongate her spine, and then she can actually expand into the collapsed area. So if she had a right thoracic curve and she was collapsing this left side, she could elongate and hold that and then collapse her body or expand her body into that collapsed area. She'd hold that, and she can slowly walk herself up. Perfect. So those are three different variations. We had the semi-hang, we had this semi-hang with some support from a band to make it a little easier, and then we actually had the seated variation. Now we're going to show one more way to do some Schroth exercises on the stall bar, and this is going to be for what's called hyperkyphosis, or when someone is too hunched over like this. One thing you want to make sure before doing this is if you have shoulder problems or you're working with someone with shoulder problems, you have to be careful because this does put a lot of stress on the shoulders. So if someone has impingement syndrome or rotator cuff problems, this may be one reason you don't want to use this exercise. Now, one thing you may want to do is put a towel between the bars in your back to provide a little bit of cushioning or padding. So I'm just going to place this right about here. Perfect. Now she's going to put her hands, if you put your arms straight all the way, that's going to be too tall. You want to probably be one down from there, possibly two down. Okay. And then I'm going to have the padding behind her back. She's going to bring her feet out a little bit. She's going to slowly lower her hips down. And again, she's just going to elongate just like this. This is forcing her thoracic spine into extension. It's also creating a nice stretch in her upper back and shoulders and her pec area, because when you have hyperkyphosis, all the musculature gets tight in here, pulls your chest and shoulders forward, so it helps open this up. So you may want to start just starting off at 30 seconds and slowly building up, and then getting to 60, 90 seconds, and even up to a couple minutes. You're going to hang there, you're going to relax, and you're going to take some deep breaths in and out while you're doing that. When you're done, you're just going to start to climb back up, just like that. So these are three different ways you can actually use what's called the stall bar, and these are very commonly used in Schroth exercises We incorporate these into ScoliBalance because we incorporate Schroth when appropriate for the patient into the ScoliBalance exercise. Now, if you're watching these videos and you're wanting to learn more about scoliosis for adults or adolescents, be sure to click on the link and download one of our eBooks. And to learn more about the most effective non-surgical treatment options for scoliosis, click on our next video and we'll see you there.